Hi, everybody. We're going to talk today about what special education is. My name is Dr. Clark, and I am one of the faculty members at EKU. And I'm going to cover very briefly for us what we can do, whether we're on the teaching side or the administration side of education, if we have a student that we suspect might have a disability, what testing requirements exist, and the federal and state categories of disabilities based on the Individuals with Disabilities Education Act, commonly known as IDEA. We're also going to talk a little bit about the special education process, the roles that individualized education programs, known as IEPs, play in the instruction of students in general education and special education settings, the important role of data and progress monitoring, and the role that general education teachers and special education teachers play in supporting students with disabilities. So first, what should we do when we suspect a student might have a disability? There are two laws that we look at primarily, and the federal laws are the Individuals with Disabilities Education Act, or IDEA, and also the Every Student Succeeds Act. So according to KDE, if we have a student that is not meeting expectations for that age or grade level, then we are looking at the ESSA requirements, which is an opportunity for every student to succeed, and we have an accountability system that we used. Within that system, there is also specific information about what we will do to support students, and that is around the intervention model. This includes every student, not just select students, in the state, including students that we suspect is having a disability, students already identified with disabilities, students who are English learners, and students who meet the gifted criteria. So ESSA gives us a framework that is also part of the earlier law, No Child Left Behind, or NCLB. We're currently under the ESSA, Every Student Succeeds Act. And in the beginning, NCLB gave us the RTI framework. Now that framework is called MTSS, which stands for Multi-Tiered Systems of Support. And when we're talking about that system, we're talking about 3 tiers specifically. So in Tier 1, we're looking at that primary tier, and that should be 80% of students in any grade level. And that Tier 1, we're looking at the school-wide, class-wide systems of support that are in place. These happen in the general education setting by general education teachers. It requires us to test every student, and for students that are in that lowest percentage within the students that we have in our classroom, we're required to do interventions, whether that student is struggling in reading and writing and math, they have behavioral concerns, whatever the concern is, we're going to collect data and provide research-based or evidence-based interventions. Again, a general education initiative provided by general education teachers. If students over a period of time, the data is showing that the interventions we have in place are not helping the student make progress, then we might look at Tier 2 interventions, or those secondary interventions. This is for smaller groups of students, again, evidence-based interventions. They're still receiving the Tier 1 supports. They're also getting Tier 2 supports. And again, over time, we're taking data and providing intervention. If students aren't making enough progress, then we move them into Tier 3. Much smaller groupings, individual interventions often for students. It can be behavior, it can be academics, and then we're often looking at if the student should receive some kind of special education services, and if so, then we would look at the evaluation process. So a different way to look at that multi-tiered systems of support framework, we have an academic side to that. So again, if students are in the bottom 15% of their general education class, then we look at tiers of intervention for students. Tier 1, always in the Gen Ed classroom. Tier 2, again, a Gen Ed initiative. And then Tier 3, a Gen Ed initiative, looking at if a student needs referral to special education to consider if the student might be eligible for services. So academics, reading, writing, and math, and we're also looking at behavioral supports. So if a student has any kind of behavior concerns, or we're looking at some school mental health, maybe the student has a background with some trauma in it. If a student needs supports, then we're going to look at using evidence-based practices in the Gen Ed classroom, and then moving them through tiers of intervention if they need additional supports, and considering, if necessary, special education evaluation. So within our state, we have the Every Student Succeeds Act, which governs all students in general education classrooms, and then IDEA, and the most recent reauthorization was 2008, which requires us to provide special education services for all students with disabilities who are identified at school age, which is preschool through age 21, as is appropriate. So IDEA has several specific tenets that all states must follow, and Kentucky follows. The first principle is called zero reject, which means if a student qualifies for special education services and we have parent consent, we must provide services. Child find means that it is the responsibility of every LEA, which is the Legal Education Association, in other words, your public school district, to look within the community and identify any students who might have a disability to offer evaluation services, screenings, and intervention services as needed. LRE stands for the least restrictive environment, which means we always consider general education first based on a student's strengths and their needs, and we're going to determine what the best place for that student to learn, but we always start by considering the general education classroom. A few more tenets. One is multi-factored evaluation, which means that every student that is being tested for special education must be tested by more than one person, and it must be more than one test. We look at the term triangulation, which means we're looking at multiple data sources to see if a student qualifies. So again, not just one test. We have the concept of FAPE, that free appropriate public education. The federal courts have ruled that we must provide services that are appropriately ambitious, that's the Andrew F. standard, in light of the student's circumstances and potential for growth, and any student that qualifies for service must have an individualized education program that's based on their strengths and needs. Before we can begin any part of this process, we must have parent consent or guardian consent before we evaluate for services, and before a student would be eligible for services, we must have parent consent at both of those gates. So IDEA is really the key for understanding and supporting students with disabilities, and all teachers and administrators must follow the tenets of IDEA. This is not in any way an option, and we are legally responsible to uphold the tenets of IDEA. So when we're talking about testing, how that happens and what that process looks like, we know that IDEA requires us to look for any child that might have a disability in our community. We must receive consent from the parent or guardian before we begin any kind of testing. We must have that multi-factored evaluation looking at the student's entire profile, and that test must be in the student's native language. So if their native language is English, then we provide testing in English. If their native language is some other language, we must provide it in that language. At least every 3 years, we must reevaluate students to ensure that they are still qualified for IDEA services. Within IDEA, we have some very specific categories for service in which a student must qualify. They must qualify under one of those 14 categories. So the most current data that we have is 2016, and this gives us the Kentucky categories for disability. Every state must have services for students. They might use slightly different names, but these basic categories are the same. Within these categories of mild mental disability and functional mental disability, this category is actually called an intellectual disability, that row 3. We also have categories for students with hearing impairments, students who need speech and language services, students with visual impairments, students with emotional behavioral disabilities, orthopedic impairments, other health impairments, which often includes ADHD, specific learning disabilities, students who qualify with deaf blindness, students who qualify as having multiple disabilities, students who qualify with autism, traumatic brain injury, or developmental delay. The developmental delay in Kentucky goes up to age 9. In other states, it sometimes ends at age 5. This is a state choice. We all must provide services for students with developmental delays, but we can provide services up to age 9, and in Kentucky we do. Notice that you do not see the term anywhere here, mental retardation. That term is no longer used based on Rosa's law. The term we use is intellectual disabilities for students that have lower cognitive scores. So if you look at the child count data that shows how many children receive services, you'll notice for ages 3 to 5, which is preschool, the predominant student eligibility categories are developmental disabilities or developmental delays and speech and language. Lots of students qualifying in these areas, not as many in the other areas, although you'll notice that autism, still relatively speaking to these other areas, is a larger category. When we get up to ages 6 to 11, and remember developmental disabilities ends at age 9, then we start seeing some of these other categories increase in numbers. And usually, if a student is going to qualify for services for academics, that's divided between the specific learning disabilities and the 2 bottom categories. The acronyms are FMD and MMD. And this intellectual disabilities is the subtotal of these bottom 2. So you'll notice those categories starting to get larger. And again, other health impairments typically are students that qualify with attention deficit hyperactivity disorder or ADHD. By the time students get older, we notice that developmental disabilities is gone because that age requirement no longer meets, and we notice these other categories are getting larger. Less students receiving speech and language, more students receiving services under that intellectual disabilities category, specific learning disabilities, other health impairments, more students qualifying with autism and emotional behavioral disabilities, and more students qualifying with multiple disabilities. So the data really starts changing over time. Again, EBD starts growing in size, more students receiving those services, and more students receiving services for specific learning disabilities. So over time, you'll see across the state of Kentucky, students receive services across all 14 categories of disabilities, and they must meet specific eligibility requirements in order to receive special education services. So what is the process in Kentucky? In Kentucky, we must start with that multi-tiered systems of support. So students must go through interventions in the general education classroom. And if you want to learn more about that multi-tiered systems of support, on KDE's website, the term is still being used, Kentucky Systems of Intervention, or KSI, but you'll notice that the triangle is still here, the numbers are the same, and it's that RTI or MTSS triangle. So in Tier 1, our students are receiving evidence-based, highly effective instruction in gen ed classrooms. We're ensuring that there's quality academic and behavioral instruction in all classrooms based on the state curriculum framework, and we've got specific requirement for what's expected in Tier 1. Keep in mind, 80% of all students should be in this Tier 1 instruction, and all students should receive access to Tier 1 instruction. But if a student isn't making enough gains, that's when we look at Tier 2, which is supplemental instruction. So a student is still receiving Tier 1 services and then also getting additional screeners, additional interventions, and additional data is being collected to ensure that we're supplementing the skills where they're showing deficits. And then Tier 3, those intensive interventions, a much smaller percentage of students, but they're still receiving that Tier 1 and Tier 2 support and then additional supports. We're going to pause right here and then we'll start the rest of this presentation in video 2.